A warm welcome to everyone. I am Dr. Ritesh Raj, consultant diabetologist, consulting at Anand Diagnostics. The topic of discussion would be diabetes and related complications and what are the adverse effects and how to prevent or control one. As we all are aware of that diabetes is a lifestyle disorder, but the initial part of diabetes also comes towards insulin resistance. So diabetes is when the blood sugar rises beyond a point and causes complications or end organ damage. But even before diabetes sets in, there is a component called insulin resistance, which usually happens in most of us when we tend to gain weight as a result of unable to exercise or probably consume more carbohydrate rich diet. And abdominal obesity is one of the most causative factors which predisposes to obesity and which in turn leads to diabetes, hypertension and dyslipidemia. Now when it comes to diabetes and its complications, in a diabetic individual, because of the raised blood sugar levels which is uncontrolled due to the lack of insulin or the resistance component of it, it leads to end organ damage, mainly the microvascular complications, which includes the kidney, eye and nervous system, the peripheral nerves. The reason being the unopposed sugar mixing with the tissues causes an inflammatory cascade which worsens the disease condition. Now when it comes to diabetes and cardiac risk, diabetes or insulin resistance per se makes the blood vessels age at a faster rate, hence losing its elasticity and leading into hypertension and narrowing of the blood vessels, which in turn can cause cardiac manifestations. It could be stroke or it could be heart attack symptoms. Now when it comes to prevention of diabetes or insulin resistance, it's a simple basic thumb rule which I would like to share. It would be height subtracted by 100. For example, if the person is weighing 70 kilograms, then his height should be approximately 170 centimeters. Or in other words, if a person is 170 centimeters tall, we need to subtract 100 and he should be weighing 70 kilograms plus or minus 5 kilograms. That would be his ideal weight for the height, and half of the height, that is 170 centimeters divided by 2, that's approximately 85 centimeters, should be his waistline. So if he is in these two parameters, most likely he is not into obesity or visceral adiposity, which can result as being non-diabetic, non-hypertensive or non-dyslipidemic. So and if many of us are in the category of abdominal obesity or a visceral adiposity, then we are the ones who need to do a routine health checkup in view of trying to identify whether we are into any of these risk complications. So a basic lipid profile of fasting sugar or HbA1c with a BP check would mandate in such individuals. When it comes to lifestyle modifications, if at all a person is overweight than his ideal body weight, then it boils down to the fact that the person has to do 150 minutes of physical activity per week. It could be a mix of cardio and weight training, and along with that he might have to or she might have to take care of the diet. There are two kinds of diet which people can follow. It could be a portion control, that's very fixed small amount of meals pattern. If the person is not that kind who can consume that way, then he can or she can try for a intermittent fasting, which would be a eating window of 8 hours and a non-eating window of 16 hours. Time and convenience of doing so is based on the patient's needs and comforts. So with this, if the person is able to extrapolate by losing half a kg weight loss per week, then probably they are on the right track.